I've knocked on the patient's door and have washed my hands before entering. Hello, my name is Samantha, and I'm going to be your nurse today. Can you please tell me your full name and date of birth? Hi, my name is Shelly Willis, and my date of birth is 12/5/1970. Perfect. Thank you. I have a few questions for you this morning, and we'll continue with the physical assessment after that. Is that okay? Yes, thank you. Okay, thank you, Mrs. Willis. Would you mind telling me where you are and what year it is currently? I'm at St. Joseph's Hospital, and the year is 2020. Perfect. Thank you so much. Would you mind telling me what you do for a living and who you're living with at home currently? Sure. I'm a manager in a human resources department, and I live at home with my husband and my 2 dogs. That's great. I also have a little dog at home. Can you tell me if you're having any pain or shortness of breath currently? Yes, I'm actually having some pain in my lower back, and I've been noticing that I've been getting short of breath when I get up to walk around. Okay, Miss Willis, on a scale of 1 to 10, 10 being the worst pain ever, what would you rate your pain at this moment? I would say it's about a 5. Okay, is the back pain a chronic issue? And on the pain scale, what number would be a tolerable number to get down to? Yes, I've had back pain for a while now. I was in a car accident a few years ago, and I would say a tolerable number for me would be to get down to a 2. Okay, great. I'm going to go ahead and take a look at your IV. I'm going to make sure that it's working well and there's no kinks within your line. It's important to monitor the site for any redness, swelling, or pain at the site, which would mean the IV is no longer working well. Okay, I haven't had any issues yet. I'm usually a hard stick. Okay, Mrs. Willis, your IV looks great. Please let me know right away if you notice any of those symptoms I mentioned. I remember you stated that you were getting short of breath when you're getting up to walk around. Do you wear any oxygen at home? No, this is pretty new for me. I usually do well getting around my house. Okay, Mrs. Willis, we're going to keep you on a pulse oximeter to monitor your oxygen level. At this moment, your oxygen level is at 98% on 2 liters of oxygen, which is great. I'm also going to give you what's called an incentive spirometer. This is going to help promote your respiratory health and exercise your lungs while you are not up and moving around. I would then teach the patient how to use the incentive spirometer. Wow, I hope this helps. We'll also bring this up to your physician to see if he has any other plans to address this issue. Now, have you had any nausea or vomiting since coming into the hospital or at home before you came in? No, ma'am. Okay, and when was your last bowel movement? Have you noticed any diarrhea? My last bowel movement was yesterday. I haven't noticed any diarrhea. Okay, great. I would then go ahead and auscultate each quadrant of Miss Willis's abdomen. I then am going to ask, Ms. Willis, how are we doing urinating? Have you noticed an increase or decrease in the amount of times you've gone to the restroom? Actually, I have noticed that I've been going more frequently in the morning time. Okay, are you having any burning or pain while urinating? No. Okay, I see that you received the medication Lasix around 6:30 in the morning. That's a diuretic, which will cause you to urinate more often to help reduce the amount of fluid within your body. Oh, okay. I'm going to place a hat in your toilet to monitor your output to make sure that you're putting out enough fluid that you're getting in. Please just call me each time you need to go to the restroom, as I don't want your shortness of breath to affect you getting to the bathroom. Okay, thank you. Okay, Mrs. Willis, I noticed that your legs are slightly swollen. How long have they been this way? I would say for about 2 weeks now. Okay, I'm going to go ahead and assess your legs for appropriate pulses and temperatures. Have you had any numbness or tingling in your legs or feet? No. Okay, great. I'm going to go ahead and evaluate the strength in your feet and legs. Can you act as though you're pushing the gas and lift each leg for me? Perfect. Now I would do the same to assess the patient's arms. This concludes my questions this morning. I'm going to see what medication I give to help with the back pain. Are there any questions you have at this time? No, but may I have an orange juice when you come back with my medication? Yes, ma'am, but let's remember that we are on a fluid restriction of 1,200 mLs in 12 hours. So we'll count that as your intake for this morning. Is there anything else that I can do for you right now? No, thank you. Okay, I'll be back in a few moments.